Welcome, everybody, to the Pelvic Health Explorers membership interview. This is March 2025, and it is my great pleasure to have the physical therapist, pelvic health researcher, and educator for over 25 years. Evelyn Hecht is with us, and she is the founder of Pelvic Sense. And I can't tell you how excited I am to have Evelyn here and to be in the same room with her. This is thrilling for me. We have hooked up together on LinkedIn on several posts and several conversations. And when I was looking at her product, Pelvic Sense, and really paying attention to it in the world of wearables are going to be such a big part of our life and helping us be extenders of our care, I knew I had to have Evelyn on to talk about her product and everything. Evelyn, tell me about your journey. Where did you start in the world of physical therapy and pelvic health, and how did
Mm.
it lead to Pelvic Sense in your work today?
Well, it certainly is a evolvement as one starts young and not really sure where one wants to be in the world of physical therapy. I started working in an orthopedic hospital, lots of surgery, post-surgery patients. I would see a lot of international clients because I spoke a few languages. I grew up in different countries. And so I would get a lot of the international clients, and a lot of them would ask me very quietly and privately, Evelyn, do you know anything about I'm unable to have intimacy with my husband. How can I have a baby? Or I'm having to go to the bathroom like every 20 minutes. Do you know anything about this? So I asked my colleagues in the physical therapy practice, do you get any of these questions? Because we hadn't learned yet about pelvic health. This is like in I want to say in the 80s. And so they looked at me, they said, no, we never get these questions. So I felt at that time as a young therapist, I think there's something about my energy that allows another person to ask me these questions. And let me look into this because we did not learn about the details about the pelvic floor and all its amazing functions. And there are muscles there are nerves there. We need it for optimum function. Let's look into it. So I started a practice in New York City about 20, 30 years ago on pelvic physical therapy only. Maybe there was one urogynecologist doctor, and most people didn't really know what pelvic physical therapy was in the medical field at that time. But I learned and evolved and learned as our training is, it's a biomedical training, meaning most pain or dysfunction comes from a biomedical tissue issue. So there's a tight muscle, there's a compressed nerve, or there's an internal organ dysfunction, etc. And over the period of time, I noticed that in my practice, as we grew years on in, the first 15 years of it was a biomedical approach. We would address the tissues. Let's work on reducing tension in the hip flexors, the inner thighs, the pelvic floor. We did internal work. And that would have helped maybe 60% of our patients. And I had some staff of other colleagues working with me. And we always were perplexed. Why are only 60% of these patients achieving wellness, and the 40% were still visiting their 15th or the 50th physician and enter all kinds of injections, et cetera, medical procedures, but they weren't getting better. Their pain was still there. So pain neuroscience, the knowledge about what pain is, what drives the nervous system and immune system to become sensitive, and why does the brain become more overly protective to send symptoms of pain, to send symptoms of muscle guarding to whatever area that's involved, whether it be a migraine, neck pain, lower back pain, or pelvic issues. Once we learn this, and it was very early on, how do we implement pain science and how do we teach our patients some of the skills to help downregulate their nervous system? Breath work, which we've been doing, but we were mostly talking about how it moves the diaphragm and moves the pelvic floor. But now we understood that breath work, deep breathing, quiet deep breathing can elevate the calm, can elevate the sense of things are safe, can help downregulate that nervous system for a moment, but that's still a good start. And so how do we implement this information? So over time, we learned that a lot of patients who wanted and now were being referred to pelvic physical therapy, the patients weren't coming. Maybe 33% out of all the referrals would go to a pelvic physical therapist. And out of that 33%, maybe 8% would complete the course of care. And there were lots of barriers for patients, financial, or couldn't find a pelvic physical therapist, or the time constraints, the therapist's schedule and their work schedule or childcare schedule wasn't meshing. The realization of working with, if we can teach pain science and how to soothe your nervous system and how to, of course, incorporate movement as well, because the body and the mind are not separate. I don't know how we became this idea that our body is completely separate from our brain, which is completely separate from our nervous and immune systems. So, how can we put them together like a beautiful puzzle piece and incorporate all the skills, gentle, easy, not like sitting on a rock in India for 8 hours a day meditating. It's not about that. It's about small movements and small mind work and understanding, why is my brain sending me symptoms of pain or urgency? And because so many people were not able to come to see a pelvic physical therapist for many reasons, why can't we put this in an online program? And by this point, it's now 2018, 2019. And so I started to write a program to allow more women and men with pelvic distress symptoms to learn the skills concurrently with their medical provider's care. So
Mhm.
that's how Pelvic Sense was founded.
And based right off of numbers, data, and things that I know that all of us clinicians that have been around the block once or twice, and certainly all of the pelvic health practitioners out there are learning, is that these numbers, about 33%, actually show up. How many times do we have cancellations on our thing? And how many times are our referral sources telling our clients prior to them even walking in our door that it's going to hurt? I have to tell you, many times I had to sit with my referral sources and just say, please do not say that. This is not about pain. This is about getting them to feel better. Encourage them to come because we can help their quality of life. Encourage them to come because we can help them achieve what it is that they're looking for. But they would say it's going to hurt because they're going to be touching muscles that are tender and sore, and you're just going to have to do it, And so the safety issue is so important. And what I love about this is meeting people where they are. They can't all come. We are like the top echelon of care. If you look at the pyramid of care, one-to-one care is at the very, very top of the pyramid. There are so many people down at the base of the pyramid that need help that can't possibly get to us. It would take millions of us to get to millions of the people, and we still wouldn't be able to do it.
Absolutely
So
not.
I love this because this helps people begin to change their life and change and understand things on a much different level, either before they can get the one-to-one care or as they're receiving care or for whatever that care looks like for them.
Yes. And I also wrote this second reason is because I wanted to help my colleagues, my pelvic therapy colleagues. Some of them are working in network settings where they have to be in an open gym like setting and treat two or three people or oversee two or three people at once. That is not a great area or way to help a pelvic patient feel comfortable, safe, private in order
Mhm.
to get the quality care. And a lot of in network centers have a protocol. We want you to, this is what you do. You have X amount of minutes with your first patient, and then we want you to protocol them through an exercise routine only.
Mhm.
So it produces that same biomedical treatment is going to help my biopsychosocial issues of pain, which it
Mhm.
doesn't. For persistent pain, doesn't. So I wanted to help my colleagues. Here is another avenue. We refer a lot of patients to buy a TheraBands or to go get a ball or to get products along with their care. So I'd like this to be considered. This is a calming mind and knowledge platform that you can do while I'm working with you, because a lot of times the therapist does not have the knowledge yet or the time to teach patients about science of pain. And I have to say that the old gaslighting methods of what people interpret pain science to mean is, oh,
Mhm.
girl, it is in your head. Go see a
Mhm.
psychiatrist.
Right.
So, this is not about that at all. This is
Mhm.
about educating on what drives the brain to feel that you're under too much threat and they want to protect you. And how can you shift out of that pattern? Because we do have the ability of changing patterns within our nervous system and brain called neuroplasticity. So again, to help patients learn what they can do while they're working with their doctors and physical therapists, if they can see one, and also to help a physical therapist be less burdened with, oh, I didn't get that information in because she only came in twice and that's it. She's gone from the knowledge points.
Right, 100%. And the way that you were speaking about not having to sit on a rock and meditate for 8 hours a day. I mean, most people, when they hear some of the mindfulness work and they hear about mind calming techniques, that's what they think is like, I don't have time to sit in a corner and meditate and, do my fingers a certain way. The small steps, the way that pelvic sense is put together, makes a lot of sense because small hinges swing big doors. And we can make one little small change somewhere. If we can be consistent with it and they find relevance with it and they feel safe with it, they're going to do it. That's where we
Absolutely.
make the best change. And this program that you have put together, I love that it's an adjunct to whatever, it's an adjunct to somebody's busy life. It's an adjunct to, a physical therapy treatment plan. And in the description of the fact that we sell TheraBand, or we give them dilators, or ask them to buy dilators, or we ask them to get a biofeedback unit or an electrical muscle stem, we're already using technology. I just think in the field, there's been kind of this thing like we can't have pelvic floor or pain science or any of these other types of things because it's not the same as me. And it's like, well, but that's actually not true. And we have more and more companies that are doing imaginative things. And I love this because this is for the person with pelvic pain, the human with pelvic pain. And it helps them with basic stuff that is so simple to do in such a safe way that they cannot not do it, which is like what we want. We want to put simplicity in the hands of our clients. They're busy. And you just said that childcare, caregiver care, work hours, having to be in 16 places at one time,
Yes.
traveling, all of the things that go on in our life. It's difficult to be able to find the time to do all of the things. So let's find the time to do a few of the small things that could really get the needle moving in the right direction.
Right.
This
Right.
is great. Tell us about Pelvic Sense itself. How is it set up? What's the journey, the experience, and clinicians access it themselves so that they can understand it as they, be able to introduce it to their clients?
Right. So when a person goes to the pelvicsense.com website, they can choose one of the three offers. And I always tell people start with the silver offer, that it is basically a monthly subscription. They have access to all the information, and I'll go over what the information is. They have access to all the information for 24/7. There's no stop and start, and it's available for them for the full month. And I ask people to practice the program. Just set aside, if you can, 20 minutes, 3 days a week. That's it. Not every day, not 5 minutes a day. Put a little bit of time, 20 minutes, 3 days a week, and give yourself at least 3 or 4 months, which is hard because
Mhm.
don't we want immediate responses to what we do for that's good for us. But our brain and nervous system needs repetition, needs practice, needs the over and over again, and for it to see, oh, she's not under threat. I don't have to always send her pain signals. I can send her more feel good chemicals to her body. Oh, the muscles don't have to be as tight around the inner thighs and the pelvic floor because she's safe. I can loosen up my signal and tell those muscles to be at ease. Patients can have, or clients can have, this 24/7 access. What they will do, it's a trio of healing skills. So there are modules that are called Learn, and this is where they can listen to what is pain science, listen to what is my amazing pelvic floor, what does it do? What's the purpose of stretching? Is it really to elongate muscle fibers? Actually, not. It's to help desensitize the nervous system to allow movement to occur because your system feels that it's safe. So it's a desensitization to your nervous system. That's what stretching does. So there are lots of different educational modules, how to use a dilator. And this is really towards the end of the grouping of educational modules, because I want people to start to understand that an upregulated nervous system, an immune system that is always sending signals of threat to the brain, is creating the pelvic floor to be on hold, on tension, on tight. So the strategy is to help a person start to implement these calming skills.
Mhm.
And learning towards the end of it, they go into what a dilator is. So this is a pelvic program. I also go into learn modules of how to improve optimum urinary stream. If you have constipation, how to do an ILU massage, oh, how to sit at your toilet, breath work, and even visualizing, if you've been constipated, the opening of the canal and allowing the body to excrete what it needs to excrete. So there's a lot of variety of learn, and it's over a period of 20 different modules. Then there is something called Rewire. Rewire are guided audios with music to help elicit the relaxation response. Many people, after 4 to 6 months of being in persistent urgency or persistent pain, all kinds of diagnoses under that chronic pelvic pain umbrella, we've learned that to decrease that upregulated nervous system, to decrease what's called central sensitization, which is a natural development that our brain and nervous system does when you've been under a lot of distress for too long. It gets into the overprotection patterning, that eliciting the relaxation response, just even for a minute or 2 or 3 minutes, where there's a sense of I'm safe, I feel comfortable, I've lowered the fight flight reaction. That is very effective. Again, small bits throughout the process of healing. So, rewire again, different visualizations. There's one where you're imagining a golden orb above your head and it slowly melts within the brain, within and around the brain, down into the jaw, feeling that the warmth of the color also melts around your neck and slowly moves down to the pelvic region. The abdomen becomes really like a warm pool. The pelvic floor is soft and widening. So there's a visualization aspect, and visualization is so cool because the science has shown us that when we imagine something, our brain responds as if it's a reality. So
Mhm.
let's use that science, which is why visualization guided exercises are healthy. And you can listen to any one of them. There are lots of different apps out there that specialize, like Headspace and Calm, that do that visualization. So you don't have to listen just to me, the Pelvic Sense program, but I introduce these aspects within the Pelvic Sense framework, focusing on the pelvic region and its functions. And then the last portion, actually, I'll go back to part of Rewire as well, is I want to help, I want to guide you on what you can do to elicit more a sense of control or to shift the narrative. I'll incorporate positive affirmations. I have 50 different positive affirmations for pelvic healing, incorporating gratitude, understanding why do I want to practice gratitude? Who cares? I am not grateful for anything. Oh, but you can be. And now that we know that the brain responds to your thoughts, I'm looking at my cat and watching how she's so soft and her fur is just breathing gently as she rests. That's very soothing to your thoughts and your brain as well. So there are different techniques within Rewire, and also incorporating expressive journaling, another way to just reframe. Can we help you start to reframe out of the natural fear and worry? And what if I'll never get better? I'll never work again. I can't pick up my child. So Rewire are different skill sets introduced, and you don't have to do them all. And you just might like one, and that's
Mhm.
awesome. This is a smorgasbord of different things, but again, given in a step-by-step program, so you're not saying to yourself, what am I going to do now? It's all written out, so it's easy to follow. And then the third trio of healing skills are movement. How are we going to separate mind and knowledge from the body? Right? We want the body to teach the brain that, hey, things are good. I can increase my flexibility of my inner thighs. I can lower the abdominal crunchy tension. I can soften it. Oh, when the brain feels that, oh, she's soft in this area and has more flexibility in this area, that area must be safe. I'm going to send her more feel good chemicals, dopamines, endorphins, all that. So you are strategizing. The program is a strategy for you to implement while you're receiving your medications and internal manual therapies by your therapist. You're also part of the healing process. In fact, you're one of the most important aspects of healing. And Pelvic Sense is giving you that roadmap of what to do and how many times you want to repeat something. It's really good. And over time, over that 2 or 3 or 4 or 5 months, depending on what you need, your system starts to learn a new way, less being overprotective, more feeling they're not under threat, you're safe. I can move better and I can send her more feel good chemicals and I can lower the pain of whatever the person is experiencing pain from or with.
Hmm. This approach is amazing because giving people like a smorgasbord of things to choose from and to try on, we really need to like figure out what strums our central nervous system because what strums mine isn't going to strum somebody else's. So there's going to be something in there that's going to speak to them. It's kind of like you get to try so many different things to see what is going to be helpful for you. Oh, I really like that one. I want to do it again and again. And that's fine. We don't have to do different things to change. We just need to be consistent, right? And then the other thing here that I just really want to hammer home, because this is for the clinician too that falls into burnout. I'm not good enough. I'm not smart enough. I can't fix these people. This is not what this is about. And those perceptions become their reality. So if our clients have perceptions that become the reality, our perceptions become our reality as well. And now we have a disconnect of co-regulation. So I love this because people can go home and have a consistent way to work on this, to try it out, to keep going with it, to keep hearing the encouragement, and for the clinician to be able to say, which one of the gratitude ones did you like? Not like, did you do your gratitude training, but which one talks to you? Maybe I like this one for me, but you're going to find ones that just really work for you. These
Mm.
things are untouchable to people. They're not tangible to people. And this particular program makes this very tangible. So people can take action on it. It's not just a thought. It's not just an idea. It's not just a piece of knowledge that somebody will or will not accept into their reality, but it's tangible. They turn it on. They can choose. They can trial. They can laugh a little bit with it, perhaps, They can hear something and get an aha moment. They can take this and begin to build their interoception. Is this really that bad? Can I change a little bit about how I feel about this? Can I actually feel something a little bit different within my body? So it's brain, it's body, but it's that interoception piece that everybody is looking for, the black and white. Like either I have it or I don't. Instead, it's like none of us feel the same every day.
No.
None of us, right? And we can take time and go, oh, I'm just a little bit stiff today. What do I need to do to kind of like loosen this up and get going? Or I wake up, I feel really good this morning. I just can't wait to go and just take on the day. So
Mm.
we all have different realities, and a multitude of choices in there helps people kind of match what they need at that day. And I love the fact that the encouragement is for 3 to 4 months and longer if possible, because talking about research, we know it takes a small, consistent activity for 3 months to begin to form a habit. And what is a habit? A habit is a neural pathway. It's why we brush our teeth at the same time every day, because we had that neural pathway established when we were kids and we went through all of the arguing and griping and we didn't want to do it and why do I have to do it, to where we're an adult, we don't even think about it, right? And so this establishes that. And you talked a little bit about that neuroplasticity, which our brain is organized to be efficient for us, to create efficient movement patterns for us so that we don't have to think about, is my foot touching the street as I'm crossing the street against traffic with noise and everything going on. The problem is when we get into like the immune system and central sensitization and neural pathways of protection, it doesn't make sense. It's like, why would my brain set something up to give me this experience? And it's simply because it's overprotective. But we have to be able to change that, and we do it by deconstructing that pathway one little brick at a time while we build a new pathway over here. And I love how you have this set up because it enables people to do it. They do a gratitude training, for 20 seconds in the morning. Well, they didn't pick up a whole piece of the old road to bring it over to the new road, but they picked up a nail and a brick. And now it lives over here. So guess how that nail and brick is going to stay there? They're going to do it again, and another brick may come over. And so the brain begins to set up more freedom in there of choices so that everything doesn't have to be run down the protective pathway, the superhighway over there. It's like, oh, wait a second, we know this one. This isn't where we do this. This is where we go over here and do this. This is where we can be soft and happy. We don't, all our choices don't have to be this experience. So I think that that's brilliant how you have this pulled together for people to be able to do it. So you mentioned the silver offer and you went through all the different trainings and modules and pieces with that. And you have other pricing differentials in there or?
Yeah, there are other offers. There are a total of three offers. One, as I mentioned, silver, it's $58 a month, and that gives a person the whole program. And what's nice about the program is it's a web-based and app-based. So a patient can decide to, I'm going to download the app. My program is placed on a large system called Kajabi. So Kajabi has an app. So they would download the Kajabi app, find Pelvic Sense, put in their username and password just once, and then they have the program on their phone, 24/7, wherever, subway, in bed at night, they want to listen to a rewire or read or learn when they're on a bus going to work. One of the things about the program is that this can be shown to their physical therapist. Hey, I'm at this level, or this is where I'm at now. And I have a question on this. And this is where the physical therapist can add to their therapeutic alliance with their patient, because they are ultimate goal for therapeutic alliance. They're all about supporting their patients, walking with alongside their patients, help them move along towards this pathway of learning something different. So the app can show the therapist where they are, and they have a little chat, and then they move on with their treatment. So it's not up to the physical therapist to have to know every single detail and repeat everything to the patient. The program is teaching them that, and the patient can become involved with, well, I thought about doing this, but like I woke up this morning and my thought went first to, oh no, is my pain going to come today? I have to go to work. How am I going to make it through the day? Then they realize, oh, I just became aware that I did this. And I learned that this is something that is a threat to my nervous and immune system. I don't want to threaten my nervous and immune system so early in the morning. What can I do right now? Let me visualize my child's face or my cat's face or my lover's face. Let me just look at that face in my mind's eye. Right away, that soothing, the tingling that occurs, it's a feel-good chemical flood. Yay, that can counteract some of that earlier thought process. So it's not a quick fix, as I mentioned, and they can show it to their therapist. The other two offers a little bit more involved if they're not seeing a pelvic therapist. Gold is $109. And I have group Zoom meetings with whoever is on Gold. I separate the men from the women, the males from the females, just to make it more comfortable. And that's held every month. So each month they are on the program. They can meet with me as a group Zoom. And I have a HIPAA compliant platform, so it's really protected. And then they also can download and keep all the rewires that I have. So they can keep it and reuse it as many times as they want. And then for people that may be sensitive to computer use or, Wi-Fi stuff, or they feel like I want to have this forever and I don't push forever because we want wellness to occur. That you don't need this forever, but I offer this platinum. You can buy it, you can download everything, all the learn modules, rewire modules, and all the move videos. And there are over 45 exercises I include in the videos. Again, all the program is for people who are seeing a physical therapist, but maybe they can't see them consistently, or who are on a wait list, a 6-month wait list to see a pelvic specialist, and they want to know what they can do in the meantime. So I include all the exercises, but I always say, if you're seeing a pelvic physical therapist, and you follow their plan of care and movement, because that's expertise and it's tailored to you.
That's great.
Yeah.
That's wonderful. So there's so many levels and people can, again, according to their safety, some people safety wise may need, I just need to know that I have all of this. And that's lovely that there's an offering for them because some people
Yes.
just really need to have that. And other
Right.
people are like, no, I really want to have the support. And it's great that I can download a few things, but that monthly support would be so awesome to have. Is
Absolutely.
to kind of like be able to ask questions and hear that other people are doing the same thing. It creates accountability, to show up, to commit in an easy way because you can be anywhere. You can go sit at the
Right.
park and join the Zoom meeting wherever you have internet. And then, of course, the monthly one is just like, it's perfect for a lot of people. I just want to come in and know what I can do and work on it and see if I like it. And that feels safe to them
Right.
because everybody's got their level of financial safety and support safety, as well as their physical and immune and all of that stuff.
Right.
And a lot of times when they learn these ideas, these trainings, these thought processes, these reframings, it starts to apply in other parts of their life too. And it's a platform that is going to allow them to, you talked about, they'll be able to share it with their medical professional, but they can share it with their friends
Yeah.
when they're saying, what are you doing? Oh, let me show you. Right? And they do. To me, it's
Right.
like when we talk about that, it's like evolutionary wise, we have been set up through our olfactory system for safety.
Right.
So, what happens when we open the refrigerator and we pull out some food that I don't know about this. Is this okay to eat? If somebody's in the kitchen, what's the first thing you do? You shove it right in front of their face and their nose and say, "What do you think about this?" Ooh, I don't know, right?
Yes.
I mean,
Yes.
because we learned through the millions of years we've been on this planet that, if something was wrong with the water, everybody came to smell it because we don't want you to drink this.
Right.
This is
Right.
not going to work.
Mm.
And but the other part, like looking at the child's picture and the kitty's picture, those things are like a bouquet of flowers. When they're brought to you, like what do? You stick your face in them, smell them, and love them, and look at them, and then you look at somebody else and you go, "See, this is like, isn't this amazing?"
Yeah.
And they'll do that. I've noticed that clients do that. Once they find something that begins to strum their central nervous system, they start sharing it far and wide.
Beautiful.
They do. They
Beautiful.
just like, listen
Mm.
to this, or I'm doing this, or have you heard of this? And I think that that's another way that the work that you're doing and putting out there, it's the ripple effect.
Absolutely. Thank you. I personally have seen this in my own life when I'm more attuned, and I'm not personally, I don't deal personally with pain, but I deal with a lot of sort of like, I'm not good enough or I'm not going to achieve that goal. And so when I start to hear that for myself, I'll become aware. I've just done that. Let me state an affirmation, whatever affirmation is. I'm on the right path. Things are always working out for me. And when I'm with friends, and I'm not trying to be, I will not tell people what to do, but I sort of encourage them to be mindful of, maybe let's not talk so intensely about the negative poor relationship you have. Is there anything that's good about it? What are some of the things, so we're not just always focusing on the negative, which drives, when you feel or think about something that's not good, how do you feel
Hmm.
compared to when you think about something that makes you feel good? How does your body react? I mean, there's a reaction to a thought. So this is a science that's out there, and the more that we can bring it to our awareness, that we can shift our thought patterns and therefore shift the way we feel, and therefore now I'm sending safety messages to my nervous and immune system, and the brain says, "Oh, I like that. Let me
Hmm.
send us some dopamine for that. Let
Right.
me tell the gut to send out more serotonin." So those are all the processes that we don't think about as humans, but that's what's happening under the hood. And why not let it be a ripple effect? Why do we have to be under a cloud all the time?
Or have something that's so private that you can't share it with anybody.
Right.
Right? Because community is about people care in their community, it's about each other. And when people do something that's good, we celebrate it. And I like the ideas of these things to be celebrated because they should be, so that people can hear that there's tools, there's thoughts, there's changes, there's stuff that they can do that are very tangible that aren't going to pull the rug out from underneath them.
Mm.
Because
Yeah.
that's the big fear. I have to change everything and everything that I am and all the stuff, and I'm never going to be the same, and I'm still not going to get well. Right? And all of it is based on such of this rich neuroscience that every day there's new things that
Yeah.
support what we already know, and that
Yeah.
also give us new tweaks and new changes on it. There's a whole idea now of heart rate variability that I talk about all the time,
Yes.
and how the work to create heart rate variability also changes the nervous system and improves the immune response. And it's rooted in breath work and resonancy frequency breathing. So yes, it's important for the diaphragm to move, but can we at least do this stuff while it's learning to move again, of course we can, right?
Yeah.
We don't tell people not to breathe until they can breathe a different way. We
Yeah.
want people to breathe in different ways so that their nervous system has more choices. Oh, I
Hmm.
can breathe rapid and heavy here because I'm exercising. I can breathe slow and calm here because I'm safe. I don't have to sit quiet and have my heart rate and my breathing be so anxiously driven because am
Right.
I really not safe? I'm safe here.
Right.
It helps the system learn that neural flexibility is so important across everything. And I love how you're applying it to yourself and just in conversations with friends and as a clinician being vulnerable enough to say, this isn't going the way I thought it would, and what if this doesn't happen? And I
Yeah.
don't know if I'm on the right track here because we all experience that,
All of us,
you
we're human.
know.
We're
Hmm.
human. We're all here to evolve. And why can't we learn some of the skills towards a calmer, evolved place? And it's a process. And there's no like one has to do it well and one has to do it right. That's off the table. If you are a beautiful human being, and right now, maybe some of us are in physical pain, but you're never stuck. You're not stuck in it. And one of my wishes for our medical system is that they start to incorporate that knowledge of a biopsychosocial effectiveness for persistent pain, not just stick with the biomedical. Biomedical is good because you want to rule out.
There's still bio and
And
biopsychosocial,
there's still,
but there's still psycho and social.
that's
It's
right.
also important. No, I love that. Listen, talking about the ripple effect and your wish for the medical system, tell us about the research that you're doing because nothing's going to move the needle more than us
Mm-mm.
studying it and us being able to demonstrate effectiveness and changes and what all
Yes.
that looks like.
Yes. So we started, I always knew as a pelvic physical therapist, I want some research. Just because I designed something does not mean it's going to do anything for anybody. So I connected with a world renowned women's sexual health researcher and her team, university team, and they were very interested in studying the effect of pelvic sense, self-directed, self-paced over a 3-month period, the effect of pelvic sense in measurements of pain catastrophization scores, in measurements of quality of life, in measurements of sexual function, the Arizona sexual function test, I think it's called, and other things. And there are 3 groups of women that we were working with, and they were all over ages of 18, and they were formally diagnosed. One group had diagnosis of vulvodynia, another group had a diagnosis of endometriosis, and a third diagnosed with PGAD, persistent genital arousal dysfunction. We started it in 2023, and we just finished our last cohort. Our research study should be published and analyzed this year. So we should have a research paper this year. We did get a little sense of preliminary effectiveness or the perceived effectiveness. What is the perceived effectiveness by the women who were doing this program of our Learn module, of our Rewire, and of our Move modules? 0 is no effectiveness. So they self-rated it. 0, nothing. 10, top tier. And so the first one that got to 10 was pain neuroscience education, the big one, a 10 out of 10 out of all the people that are a smaller sample. The second Rewire was rated an 8.3. And the third, the Move was, or actually the Rewire was like in the 9s and the Move was in the 8s. So still anything over 5 is excellent. Again, this is the start. We don't have the results yet, so I'm hoping there's some changes in pain catastrophization score because that's a big one. There's another research done recently by a different type of pain science and mindfulness type app. People using it for a short 6 weeks had shown small, but there were still significant changes in lowering the pain catastrophization score. And pain catastrophization score sort of opens a door to lowering a person's depression and anxiety. And it was a
Exactly.
big one on anxiety. So we're hoping that, again, this is not pelvic sense and the work. It's not a cure-all. It's a complement. It's to help person be part of the healing process, and we want to see results. So that's what's happening in 2025. And my team, the research team, just got funded from the Canadian Institutes of Health and Research, CIHR, to do a 3-year randomized control study. of the program with women diagnosed with vulvodynia. So it's very promising. And I hope the results would be promising enough for medical professionals to feel even more comfortable, use this program while I work with you.
That's fantastic. And I know from people like Carolyn Van Dicken and others that are in the Canadian world and have been in the pain science world forever with pelvic pain,
Mm,
that the Canadian government has prioritized and exemplified the need for services for pelvic health conditions.
so
Go
good.
Canada.
Go
So,
Canada.
right. And I just think that it's amazing and that you're part of this world that's really bringing this forward because truly we want the medical systems to change. We have to show, we have to show effectiveness. The
Yes.
other thing, though, that I think is so vitally important, and I know the shift is occurring, never occurs fast enough for me, but I know the shift is occurring, is that we have to collaborate with our clients. We cannot be attached to their outcomes. We can only be attached to their journey. We really, really have to keep that in mind because we also need to take care of ourselves, but our clients need to know that they have it within themselves to make changes. This work that you're doing helps them become empowered
Mm,
because what can I do? What can I do? What can I do to make this better? You know,
yes.
we have lots of things for you to do. We just need to pick a few that you're going to stick with and
Right.
stay with it for the term. Let's like keep moving it forward. Our
Right.
day's going to be bad? Yes. Our day's going to be great? Yes. But guess what? It was that way before.
Yeah. Right.
Right? As Lorimer
Exactly.
mostly would say, don't be afraid of the flares. They're going to happen.
They're
Just
going to
a gift
happen.
and opportunity to learn,
Right.
instead of being like, oh, it's all back the same. It's never going to change. It's like, no,
Right.
look at the evidence and the data that shows that, hey, for 5 or 6 days, you were here, and then you had one day where you were here. What was the next day like? Okay, it wasn't as good as this, but it was different than this one. And then now this one's good. That's changing. Like you said, that variance in how they feel and being aware of how they feel and their thoughts and processes, realities, and things within that. They learn that what can I do that morning when they wake up? And I don't want to tell my nervous system it's not safe and fire off all the overprotective stuff again. I want
Mm,
to tell my nervous system it is safe. What can I do here? And do something now. And it doesn't take, I think, some of the latest research, 7 seconds, right? In 7 to 10 seconds, you can do one thing that will start to shift your brain over to the pre-mid-frontal cortex out of the sympathetic drive system. So the work you're doing is like lining up right with everything that everyone is talking about, and it's for people with pelvic pain. And I don't think we can emphasize that enough. So,
yes.
because this is always like the afterthought of research. Oh, yeah, we can do this with back pain and neck pain and knee pain and
Nope.
foot pain. Well,
Mm,
what about pelvic pain? Well, we don't
yeah.
know. We have these great things, but we don't know if it works in this population.
Right.
I love this because it's like, okay, we have this great thing for this population. What is the effectiveness of it?
Exactly. Exactly.
What do
Um,
people find valuable? What do people like are cheering about? And what are people kind of like, I'm not so sure about this, but it's still much better than doing nothing. Like
right.
if those numbers hold up, like an 8, in the movement part, and that would make sense to me in a way because that's probably the least safe thing. You know what I'm saying? It's like, I don't know. I don't ever, before when I did that, it didn't work, right? So
Right.
there's probably still a little of that hesitancy that happens there. But all of that could be morphed once you have those numbers and those ideas and the
Mhm.
team is moving forward. So
Yes.
this is
Yes.
so exciting. I
It's so
love all of
exciting. And
this.
and I'm really thrilled if pelvic physical therapists or even the primary physicians, because they see over 50% of chronic pain, general patients. Certainly, some of the chronic pain patients are pelvic pain. If it can be given, if it could be open the door right at the first visit with their physician, for this, the physician in our world is still considered the top tier knowledge of everything. So if they can start to say part of your symptoms have been going on for more than 6 months, let's have you start if it's a pelvic issue, let's have you start Pelvic Sense, or let's have you start another app that does the same thing for general back pain. There are more companies coming out with products that are of that type of base. So let's start to give these patients the permission that, you know what, doctor referred me this.
Hmm.
Or my pelvic physical therapist wants me to do this. And so that validates for them that this could be work because
Mhm.
I think a lot of people feel, oh, what is this really going to do? It's woo-woo stuff. It's been old fashioned and not really doesn't really help. I don't really see an effect immediately, so it's not going to work. So it
Mhm.
shifts out of the pattern that we're in our culture of that when you do something, you get the result you want. When I want to go buy a car, all I have to do is contact the car company and just go get a car. It's not the way our system needs that
Right.
practice, repetition. And if we got the validity from the pelvic therapists, well, I know they are, most of them are doing this work. If they got the validity from the physicians from the get go to do this as part of your healing process, as equally important as the injection, as the Botox, that would be
Mhm.
amazing. So
Yes.
I don't know if I can do this.
Perfect.
I may have your permission. I actually wrote, if anybody's interested in getting Pelvic Sense silver or gold, I wrote a coupon for people if you're allowing me.
Wonderful.
So if people want to try at least a month of one of the programs, the monthly subscriptions, they would go onto my website, which is Pelvic Sense, like common sense, pelvicsense.com, and they would enter your coupon is LTI Physio, PHYSIO. They would enter that coupon into the coupon code at checkout. So they would get $20 off of the $58 for the silver.
That's
Or
fantastic.
yes,
Yes, thank you so
yeah,
much. And so everybody, that's in the notes below, how to get in touch with Evelyn, the pelvic sense. You'll share your research when things are happening, or I'm
yes,
sure you'll be on LinkedIn. If you're not following Evelyn on LinkedIn, follow her. She has some absolutely great postings. There's a lot of conversations that go around with a lot of us on LinkedIn with this type of work. And I know that you'll be putting the research out there as soon as it's out.
absolutely.
So,
Yeah,
follow her there and pay attention. And I will drop all of this into the membership. But this is for also everybody who's listening. Thank you if you're joining us from LinkedIn or if you joined us through my newsletter or through any of Evelyn's contacts in her list. You're welcome, and you're welcome to use that code. And let's keep this moving forward.
let's keep
Evelyn,
the
thank
movement forward.
you so much for your work, your time, your contribution to the field, and for joining us today and sharing your wonderful chunks of wisdom. We greatly appreciate it.
My pleasure. And again, appreciate you for all the good work you are doing and continue to do to move our profession forward and to make life of healing comfortable for the practitioner as well as for the patient. It should be comfortable for both. Thank
Absolutely. All right. Thank you.